Good day, everybody. Another episode of Dialysis Tech Tips and Tricks, where I'm going to have to find a new name. I think it's a little bit of a mouthful, but what I wanted to talk to you guys about today was wet sticks. Some of you may have already heard about this before. Some of you have already been practicing this for decades. However, and a lot of the reason why I make this channel content is to continue to get information out there, because there's some folks who never have heard of this before. This is a technique that you want to use especially on brand new cannulations, because you're going to be doing 17 gauge needles. Ignore the blue wings, but you're going to have 17 gauge needles. You're going to have low flowing fistulas. You're going to have difficult to stick fistulas, and you're going to have clotting problems. As we all have experienced going into a new fistula, those little suckers can clot really quick, and then it's like crap. You don't want to fish around because it's brand new, but then you have to pull the needle. It's a mess. So easy thing to do. Get yourself a fresh 10cc syringe of saline. Whatever you have. I've seen 5 cc's. And you're just going to connect it to your fistula needle. And you're going to fill it. So just take it and go. Oh gosh. So sorry. That's never happened to me before. Catch you next time. You're going to fill this baby up with saline, and you're going to just use it like that. You can clamp it if you want. I usually do, just because, no, you know what? Normally I don't. You can check it with the syringe if you need to, but even with the saline, you're still going to see that flashback near the hub. So if you're in there, especially if you feel it, you experienced cannulators know right when you hit that sweet spot. But what this is going to do is it's going to prevent the little blood in that little needle bit and even up into the hub from clotting, because there's such a low flow through that fistula, or the patient has high clotting factors. They're probably not even getting a heparin bolus in some cases. You know, every situation is different. You can even use this technique on patients that clot frequently, patients that you have difficulty sticking. That is a really great idea, because when you're sitting there having to work with it, if you have that saline in there, it's really going to help prevent the clotting happening at that needle area, which we've all experienced, and it sucks. You know, you're like, I got it, I know I got it, but you got no pull. And then you pull it out, and you get this big old little thing of spaghetti coming out, and like, you were there, but suction sucks. Alright, so the other thing I wanted to talk about here is a little controversial, in that I know that it is probably not policy with most of you guys. Let me explain my rationale, and I will explain to you, well, I'll explain to you my process first, then the rationale. So I know that it's very, very common practice to, once you cannulate the fistula, you know, you get the flashback. I'm going to recap this needle like every good tech should never do. You fill it out, you know, bam, you see the flashback, open it up, you bleed out the needle, cap it, clamp it, right? The problem I have with that is, what does blood do when it stops moving? What does blood do when the patient's alarming and the lines are full and we can't fix the stick? That jazz turns to jello, like a gross jello. I wouldn't try it. Anyway, maybe the people in Pennsylvania, they have like blood sausage and blood pudding. That's kind of gross, but not my thing. To y'all who like it, do you. It will help. What I do is I leave it. When I see the flashback there at the hub, that just natural pulse rate of the body is going to keep that little bit of blood in motion. Now, I totally get, you know, it's still going to exert a little bit of pressure here, but the rest of all this stuff isn't really going to feel that. So what I would do personally is I would connect it, just get the flashback and leave it. That's it. When I was ready to connect, then I would bleed out the needle and then connect the lines. If you're working with other people, as in some places like the nurse will have to administer heparin, or other people may connect your patient, do them a favor and clamp it. I know Liberty Diamond folks, I know I didn't do this often. I didn't clamp it very often, if at all, and I'm sorry about that. But that way, if anybody's not used to this way of doing things, they're not opening it up and being like, oh, blood! So that's my rationale. I'm not advocating for you guys to do it. I'm just explaining a technique that I used to use because I wanted to prevent clotting from happening in the fistula needle. I hope you guys have a wonderful day. Take care, and good luck with those terrible sticks.